I'm very concerned by the federal government supporting the principle of imposing taxes on people based on their health condition or choices. That violates the fundamental principle of universality in Canada's healthcare system, which is one of the guarantees of the Canada Health Act. I am very concerned about the announcement that the government of Quebec intends in principle to pursue a tax of some kind, a special health levy or charge on unvaccinated individuals. We obviously strongly encourage people to get vaccinated. Doing so is the best way to protect their own health, but also prevent the unacceptable pressure on our hospitals and healthcare system. And it's true that the choices made by people not to get vaccinated collectively impose greater costs and burdens, stress and strain on our frontline healthcare workers and our healthcare system. That's unfortunate. But ultimately, we as a society, through universal public health care, agree to accept that the consequences of people's choices. We may not like it, but it's a moral obligation that we have not to pick and choose who gets care based on their financial ability. Because the implication of this policy is that low-income unvaccinated people would be denied care, which is, I think, inhumane and unethical, and certainly un-Canadian. We do know that a significant number of unvaccinated people come from disadvantaged backgrounds, lower income backgrounds, and often from minority community backgrounds. We can see this in the data, for example, in the United States. So I think this could ultimately end up being a kind of indirect discrimination against people who have multiple barriers, multiple challenges in their lives, including poverty in many cases. You know, I can very much, when I'm in speaking to homeless shelter directors, they tell me anecdotally that a lot of their clients have not been vaccinated because many of these people are coping with significant mental health challenges, and they are afraid. They are legitimately afraid of the vaccine. I think they're mistaken, but sometimes you're dealing with people who might have very serious mental health issues. So should they be denied care? Should they be forced to get out? Well, they don't have a credit card. How would they pay for this extra charge? So it makes no sense to me. And if we are going to go down that road, then does anybody who is overweight, do we put everybody on a weigh scale and determine based on their weight that they have to pay extra to access the healthcare system? When a drunk driver makes the terrible decision to get behind the wheel when they're inebriated, and they end up crashing their car, or they need emergency care, we don't ask them. We may look very negatively at their decision, and they may face criminal consequences for that, but we don't ask for their credit card on the way into the emerge. So I think this is completely wrong. I think it's un-Canadian, and I hope that the federal and Quebec governments walk this back.